Welcome to the Pause It podcast. I'm Dr. Sam. With me is Dr. Robert. Dr. Robert, how are you?
Good. How you doing, Sam?
I am doing great. It's my day off, and I just picked up everybody from school and their various activities, and they have a few minutes right now where they have their electronic time. So it's given us
Electronic
a
time.
minute to yeah, you actually have to like pay attention to how long they're on their electronics and everything.
Yeah.
And so we're pretty, especially during the week, we're pretty strict about like how much time they spend on it and things like that. So they get a little free
Yeah.
time.
It's
And
tough, man. I was like, my nephew, he knows how to use a phone better than I do, and like, you
oh, I
can't
know.
restrict like it too much for them because like I think it actually will put them at a disadvantage growing up. But I think it's
Yeah.
also like find that balance is tough. So I
Yeah.
commend you for it, and I don't
Yeah.
look forward to it myself.
No,
A
they literally
plus.
come out of the womb like scrolling. You're like, how do you know how to do that? I
It's
didn't
actually
even
incredible.
have those.
Oh,
But
that's
yeah, no,
funny.
you do. You have to like for their growing brains and stuff like that. I mean, you have to find a balance, and you don't want them to be, not be able to interact like normally and stuff like that. Like we're pretty strict about like when we go out to dinner and stuff, like we don't give anybody tablets. It's like everybody has to,
Be
talk
present.
and yeah, have a conversation.
Especially you and Paul, like you're both very like social people, so I feel like your kids will have that.
Talkative people.
Yes, it's if they don't have that gene, I don't know, just it'd be weird for me.
No, they definitely do. They all have something to say. But that's
That's
good.
funny.
We like to hear what they have to say.
Yes. And we like to hear what you have to say as our audience too. So continue to send us your questions. It's a
That's
quick
right.
little plug for that.
Yes, podcast@mybalto.com. Always send us your
Yes.
questions. So today we're going to delve into something that we've kind of touched on before. We've talked about diagnostics, but I think specifically talking about like specifically blood work and what the difference between certain types of tests are. What when we say blood work, I think sometimes we just like throw it out there and we don't really explain what specifically we're doing. And I'm curious to know if you run the same blood work as I do, an emergency. I'm guessing you probably do. There's a lot of overlap. Um,
Yeah, I would say to a certain extent we probably do run some of the things, but I guess the one thing I'll say to like all pet owners is like there are so many variations of blood work and different things we can test for that like I have to look it up sometimes almost every time. Sometimes it's a little more unique or your case is a little bit different. Which
yep.
one save you the most money with giving me the right answers? Because it's not usually on the hospital itself, it's usually like the lab and how they put together certain tests. So like they might check kidney values and liver values on one test, but only kidney values and electrolytes on another test. And
Right.
I need a combination thereof.
Yeah.
So that's why sometimes I think that's the biggest thing is trying to find out like how we can utilize your money the best way possible while still getting the answers that we need to treat your pet.
Right. I think it's so important to mention too, like you said, like some hospitals have certain tests that they run all the time. So like we like our comprehensive, what people in human medicine would call like I think they would call it like a what do they call it? Like a metabolic panel or something like that. Like that's usually
Oh
what we
yeah,
call
yeah,
it,
yeah.
right? But like
Yeah.
we would just call it like our CBC and our chemistry is what we're running. And the thing is that we run so many of them that we get a better price on them. So sometimes people are like, well, can we just run, like you said, can you just run kidney values? Can you just run liver values? And actually doing that would cost our clients more money than if we just run the full blood work again, which seems
Mhm.
counterintuitive, but it's because of the way they're packaged together and we buy
Yeah.
things in bulk and mass and like so and they give us honestly they give us breaks on certain things that we do all the time to
Yeah.
keep it affordable for our people. It's actually a really nice thing. Sometimes when we have to run a test that's out of the ordinary, it's like shockingly more expensive, and not because of us but because the lab is charging us more.
I'm really glad you brought that up actually, because I feel like that happens all the time. And I feel like a used car salesman most of the time when I'm trying to sell them something like,
Right.
and if you bundle the two of these, you can save 15%. It's like,
Yeah, yeah.
but it's kind of true. Like we're saving you some money, we promise. But yes, it is a little more expensive. You get more information. It's like the worst part of the job. I'm like, I literally tell them, I'm sorry, I'm selling you on this. This is not what I'm trying to do. It's just
Yeah.
it makes more sense for your pet.
Yeah, I know. I
Yeah.
really do. I always try to feel like it is similar to sales on some level. It's like, let me build value for you. Let me let you understand why I need to do this. And I think one thing that when we were kind of talking about what did we want to talk about today that you brought up was like, well, why do we run it and then sometimes rerun it and things like
Mhm.
that. So I don't know. I'm curious to know in your situation where that comes up the most.
Uh,
And why do you do it? Maybe let's explain it to people.
No, I think it's a good point. So I think the biggest thing is a lot of our patients are hospitalized overnight, and especially the ones like in our critical care ward, where they have things like diabetes and or they have significant changes to they have an acute kidney injury, and we're trying to track the progress of like if they got into a toxin, we're trying to track that and see how much worse it's getting. Do we need to increase their fluids? We'll check like their diet, like check their blood sugar. Electrolytes are a big part of that too, especially a lot of those diseases have effects on their potassium, their sodium. If your sodium goes too high too quickly, it can cause brain damage. In a nutshell, I'll say the physiology part of it, but it's a problem.
Yeah.
So like those things are really important to what we're doing, and so it seems I feel bad because I'm just like, why is there like 4 things of blood work on here? I'm like, because we're gonna check it every 6 hours. Because if I don't check it in that 6 hour time frame and it does go through the roof, your pet's brain is gonna swell, and
Right.
that's important.
Right.
So there are reasons for it. I think sometimes, myself included, sometimes we forget to mention like why it's important.
Right.
We just say, hey, we need to do all these things, and some future podcasts we'll talk about vet bills themselves and like why they're annoying.
Yeah.
Um,
And also why they maybe put them the way that they do, which I think people do need to understand. So I think that is a good topic for another time for sure.
yeah,
Um,
but you guys probably do it as well. I would assume like if you have sick patients that come through and they might have normal blood work the week before, but
ooh,
something's changed, right?
I will tell
And
you, I just had a case like this actually,
oh,
where it was not me, but one of the other doctors that I work with saw a dog that presented initially like just an acute, gastroenteritis, which, upset stomach. Blood work was initially pretty normal.
mhm,
And so what he did was totally reasonable based on the blood work that first day. And when I'm talking about blood work in this case, I'm talking about a CBC. So that's a complete blood count. So that's going to tell
yep,
us, are we anemic? Are we, are our red blood cells too high? Do we have a platelet issue? Do we have a really high white blood cell count or a really low white blood cell count? I mean, that's basically what we're getting from the CBC. The
mhm,
chemistry is going to tell us, like you were talking about, what do our electrolytes look like? What do our kidney values, our liver values, protein, things like that. Those are the things that we're looking at when we look at that. And then a lot of times we're putting it together almost like a puzzle and saying, okay, well, that's interesting. This dog is okay. They are not anemic, but they are, hypoglycemic or whatever it is. And you start to kind of put
yeah,
together this picture. Well, this dog is not particularly old, doesn't have any long term, chronic disease processes, but this dog came in, presented this way, had pretty standardly normal blood work, and then was sick, didn't respond to symptomatic care, didn't
mm,
improve, really wasn't getting better, maybe got like a little tiny bit better, but then got worse. Sort
sure,
of this kind of odd response to just it should have gotten better. You know what I mean? It just
yeah,
didn't follow the rules, should have gotten better. And so these owners were just getting very frustrated, like he's just not improving. And at that point, I said, well, if he's not improving, we obviously need to see him again. And initially, they had turned down some of the other the other tests like doing x-rays and things like that, which that's
mhm,
okay sometimes. We don't have to always go and do every single thing, but I said, there were some other things recommended. Why don't we go ahead and check those? And then when I looked at the dog, I went, I think we should just recheck that blood work. It's been a week. He hasn't
mhm,
really eaten. I don't really know what else is going on. Sometimes I'll look at them and be like, I don't know if we need to recheck it, but in this case I was like, I really like something is wrong here.
yeah,
And that we're going to consider our baseline blood work. And now we're going to see if things have shifted. And at this point, the owners were really all in because they wanted to know. I mean, I got the benefit of being the second person to see the case, right? So
yeah,
a lot of times the smartest person is always the second person because we have the, benefit of what the first person did.
yeah,
And so I was able to look at what my colleague did, which was totally appropriate, totally reasonable for the situation. And then, look at what happened next. Well, we talked once before about, did we ever talk about Addison's disease? I think we talked about Cushing's.
oh yeah.
I'm
Oh, well,
not
I
sure.
think. Oh
Maybe
crap! What
what
am I
I don't
saying?
know. We'll have to go back. We should know
Yeah.
that, right? As the people,
I
but
mean,
but
well, fun fact, we have like a year of episodes coming up. We just talked about today.
that's
So
true.
we've had
Exactly.
quite
So
a few of them. So thanks for being
yeah, we
loyal.
have. That's true. When we've done like over 40 podcasts, so that's true.
Yeah.
But yeah, so the sodium potassium ratio
Yeah.
was, I mean, slam dunk, like
Oh,
that. And I was like, oh my goodness. Like, and we had done the radiographs, but while we were waiting, did the blood
yeah.
work and did the radiographs while we were waiting. The radiographs were totally unremarkable. And I took one look at the sodium potassium ratio and I was like, I need to do a cortisol. Oh my gosh. So I did a cortisol and well, it was very, very low. And for a dog that has been very, very sick for a week and is in a clinic, it should not be. So I did an ACTH stim, which is the test that you would do to confirm that. Yet again, another blood test. But
Yeah.
and this dog was Addisonian, and so
It's a really good example though. That
but
Addison cases are a perfect example of that.
yes, exactly. So we're not just telling you to repeat blood work to spend your money.
Yeah.
Sometimes when things present acutely, they look one way. And
Mhm.
then a week later, or even 3 days later, sometimes, especially with a
Yeah.
toxin or, I don't know, fill in the blank. I mean, there's
Oh
there's
yeah.
a lot of situations where all of a sudden you're like, oh, that's what's happening.
Yeah. Well, I've even had a dog that just had bloody diarrhea. I saw it in the beginning of my shift, like right when I came in, sent home on supportive care. It did significantly worse over the next 12 hours. And I came back in and I actually repeated blood work on it myself. And its red blood cell count was through the roof. I had a really bad case of bloody hemorrhagic gastroenteritis, which is just a
Mhm.
really, really bad bloody diarrhea. The
Right.
dog had to be hospitalized for like the next 3 days.
Wow.
It was a bad one, but just that was within 12 hours even sometimes. So it's tough to have to like say, hey, we just did it. I know, but there's a reason for it, and
Yeah. Hmm.
something changed. So those are kind of the frustrating things, and maybe a good point to talk about is like the differences between in-house blood work and blood work we send to a lab.
Yeah. Oh,
Um,
yeah. And that also varies by clinic. So I guess what
yeah.
do you run that you can get cage side, and then what do you have to send out?
So yeah, I think the one we have like a critical care panel. It looks like kind
Is
of
it
our
like an
essentials.
iStat? Is it the one that's like,
Yeah, like an
yeah,
iStat. We call it our EPOC, but yeah, it's like our EPOC. They all have similar programs, but they're just like an abbreviated like all the really bad things that you want to know about real quick that you can get an answer in like 3 minutes on, which is
yeah.
really important for what both you and I both do.
Well,
Because
we don't
sometimes,
ours we have like a in-house, CBC machine and chemistry machine.
oh
So
nice,
we're gonna get that answer in about 20 to 30 minutes. So
okay, so
not,
that's pretty solid
yeah,
too.
pretty fast. I mean, pretty
Okay,
good timing. Um,
yeah,
but the iStat, I don't know whatever you call yours, like we don't have like an ionized calcium on ours, which I'm sure
okay,
you do, right?
yeah,
Yeah.
yeah.
And like you probably have bicarb on yours would be my guess.
Yeah, it's like more the blood gas, like the pH of
Mhm.
their blood,
Yep.
the lactate, which is always a big marker for
Right.
us, blood sugar. Pretty much the things that it doesn't necessarily have liver values on it, but like it has markers of liver health. So like
Issue.
if your
Yeah. Hmm.
blood sugar is bad, I'm gonna probably be like, I should maybe check that at some point if you're a
Happening.
really
Yeah.
old dog.
Mhm.
But I
Like
think a common
really.
misconception about a lot of things is that owners always come in and be like, hey, I want my dog's blood work or my dog's blood sugar checked because they haven't eaten in 3 days. Um, unless you have a very small dog or a puppy.
Even if
Yeah,
you have a really small dog, only if they're a puppy. I think
yeah,
like,
really, yeah,
yeah, I
pretty much
mean
only if
once
they're
once
unless they're
they're,
Yorkies every once in a while are like the ones that like to throw a wrench in my plans, but
yeah,
outside of Yorkies, but they're also really, really tiny. Um, your blood sugar doesn't usually drop from not eating. There's
not at
bigger
all.
problems,
Yeah.
much bigger problems.
Oh, this
But if
dog,
that,
this dog that I'm talking about, and
Mhm.
even with being an Addisonian, which is interesting, was not hypoglycemic,
Oh
shockingly.
really?
Yeah,
Oh, that's
I
pretty
know.
cool.
And that does happen with Addisons, by the way,
Yes.
for anyone listening. But so
Yes.
so that was part of the reason why, like at first I was not even thinking, and then I looked at the NK ratio and was like, oh no, we gotta check that.
Oh no.
Oh no. But it actually made sense, right? Like when you have a dog that's just like not responding to care and you're like, why? And it was middle-aged.
No, that's a really good example of like reasons why we do repeat those blood work and
Mhm.
even in house, like our hospital is usually like a referral facility. I'll even repeat some blood work at our lab because if they're gonna be hospitalized, we want to have the same consistent values
Right.
for the next couple of days. Because like, let's say your blood work is not to say off, but like the difference of a couple of points, but just because of the machine, that can make a difference whether or not say your patient's not improving or not. Because I repeat the same blood work and it actually went down by 3 points on your blood work, but we
Right.
didn't do your blood work and it's the same on ours.
Hmm.
Well, now I'm worried that your kidney values haven't changed. Are you urinating appropriately? is your
Right.
toxin or can you injury getting worse? So it's those type of things that they do play a difference. It's always hard to explain that to owners, but like, yeah, we're going to repeat the exact same blood work that you just did 6 hours ago because we need to be consistent from time to time that we do it,
When you
and
send
that's
your blood work out, how quickly do you get it back?
we get it back that night usually.
Because you
We,
have
the
a
lab is
lab there,
fortunately very
right?
yeah.
Yeah.
Yeah, the lab's pretty close to us. We do have an in-house CBC chem, but we don't even usually we don't use it anymore because it's we just get back quick enough from the lab and it's more accurate at the lab than it is for the in-house machines. Um, Not that it's any veterinarian's fault, but the in-house machines aren't checked up on as frequently as the lab machines are because they have to do checks every day, like sometimes multiple times a day to make sure they're accurate. Whereas most veterinary clinics don't have that type of time
Yeah.
to
We
check
do a
that frequently.
lot of QC, I will say, like our that
Yeah.
we're really on top of it. I will say that a lot of our things match. I mean, there are times where there's some
Huh.
things you get to know your own machines a little bit, right? So like there's certain
Yes.
things that happen, like cat platelets always read low on our machine.
Yeah.
So
That's
I
how I
mean,
find people like that.
I do a smear on every single one because you don't want to just go, oh, well, it's our machine, and then find out, oh no, it was not our machine. Like this is really not good. So
Yeah.
I will, as redundant as it may seem, even if it's just slightly, I will do it and make sure that I do a manual count. But yeah, we do have those things where we're like, okay, I mean, I know that that's what it is, and a lot of times I'll even tell an owner like, hey, I think this is what it is. Like, I think it's just the machine. I think it's erroneous. I'm gonna check it. If you don't hear from me, I checked it and it was fine.
Yeah.
And my techs know me well enough to know that there's already a blood smear waiting for me in the lab. I'm gonna go look at it. I'm gonna check the morphology. I'm gonna look at the platelets and I'm gonna count them. And then I'm gonna make sure I see a whole bunch of clumps. If I don't, then I'll have a different conversation.
It's funny how many times I've heard that from people that are like I just know my machines. Like I know when they're a little bit off because the calcium always runs a little bit low or this
Right.
X, Y, and Z. It's kind of like knowing your kids. I feel like you
Yeah.
just kind of you know about how their little quirks. So
Yeah. You're like, I know my 4-year-old has to go to the bathroom, even though he's throwing up and down that he does not have to go. I'm like, that's your pee pee dance. You got to go to the bathroom.
that's the PP dance. Oh, that's
Oh
hilarious.
man, if he heard me say that, he'd be so embarrassed. A
Well, fortunately, you won't listen to this for what I don't know, probably 10 years
long
from now.
time,
So
exactly. But then we'll all just
fine.
laugh about it. It'll be funny.
Exactly, it'd be funny then. But yeah, I think those are the big things with blood work that I think are just important to get across. And I mean, how often do you go over all blood work with every owner that submits something to you, or do you sometimes email them things, or do you always get to follow up with a phone call?
So it's going to be a little bit of everything. So
Okay.
I usually will, if I know I have a big workup and a likely hospitalization, I'll send the owner home and I will call
Mhm.
them with an
Okay.
update, let them know like what we're doing and kind of, especially if we're keeping their pet. Um, if it is a recheck where I suspect a change in medication is going to have to happen, so like especially if we're checking like thyroid or something on a cat, or you know what I mean. And usually I'll have a good sense like, are they keeping their weight? Are they, how like all these things, like I put the whole picture together. So sometimes we'll have them come a little earlier than our scheduled time so that during our scheduled time I can walk in with the blood work and say, okay, this is what I'm seeing, this is what's happening. Particularly nervous clients would generally like to go through the blood work with me, and with those people I'd prefer to, because if I'm going to send them a copy, if I don't address all the things that are red or blue, they're going to call me later and ask me why things are
Yeah.
red and blue and I didn't tell them about it. So I think we talked about once before too, like sometimes they're red or blue because they're a tiny bit over the thing or a tiny
Yeah.
bit under, but they don't matter and it's okay.
Yeah.
And not every pet falls in the reference interval that you have, but you start to look at trends and you know what's acceptable. And some things might be normal for that dog or that cat, but just the general population in your area that your reference interval is based off of, it's not. Okay, that's fine. Um, so I think it really is owner dependent. There are some people who only want to know normal, abnormal, like they don't want all that information. And so you get to kind of know your people, which is maybe a difference between you and I. It's like you don't really know who you have, although you probably can tell from the initial meeting.
Yeah, you get an idea, but I agree. I think probably having that personal relationship helps a little bit, just in terms
Mhm.
of understanding like what they're like historically, and
Right.
because usually most people that come to the ER, they're a little more stressed out. They want to know all the things, and But I think that's always the tough part of the conversation because like I'm almost sometimes hesitant to email them the blood work after I've talked to them about it because like I won't have talked about the important like the subtle things that really don't matter and it doesn't affect their pet's health. And most of them hasn't bit me in the ass. But sometimes I have an owner that comes back and they're like, why didn't we talk about the bicarb or they'll mention that the letters like
Mm.
this was off. I'm like, yeah, but it's part of their disease process. It doesn't change anything that we talked about. It's just something that I know that yeah.
Yeah, you don't
So
necessarily need to know. And also too, sometimes you'll get either nurses or doctors that will like look at it through the lens of humans, and you're like, but that really doesn't mean that much to us. Like
yeah,
AST is a bigger deal in humans than it is in dogs and cats. Like it's
yeah,
just that's you know what I mean. So or even like we'll get into I think another time like urinalysis and stuff like that. But like some of the way that they look at urines versus the way that we do and the things that they'll hang their hat on is a slightly different than
yeah,
us. And so and I know this from talking to my sister, talking to my dad, talking to my mom, like
yeah,
sometimes oh hemoglobin's a really big thing, like they'll you know I mean, they always want to
yeah.
point out the hemoglobin, and it's just different, you know what I mean? The things that we focus on, the things that they focus on are a little bit different, which is okay. It's just, you know, as long as they're
And
I don't mind answering the question. Every once in a while you get somebody that is not kind about their questioning. But as long as they're kind, I'll explain anything.
oh yeah, it's I think that's the funniest thing. Like, as a tiny pivot.
Yeah.
I think like for medical professionals that are in the human industry, like they're either my favorite clients to work with
Yeah.
or my least favorites because
Yeah.
like they're either like super chill and like, hey, we get it, we understand how medicine works.
Hmm.
They'll ask and they'll let me know up front like they're in the medical profession, so I don't have to I can
Explain
explain
rudimentary
things
things. Yeah.
exactly, so I can like be quick about the conversation. And then there's the other side that challenge like literally everything you say, and I'm like, I know you're a medical professional as well, and I respect that, and I will listen to you when you tell me how to take care of my health. Trust me that I'm helping you take care of your pet's health, and
Hmm.
they're just it's kind of funny. So they're either the best of clients or literally some of the hardest.
Yep.
And my interns are always so nervous going into those ones. They're like, oh yeah, the techs will walk out of the room and be like, yeah, they're a medical doctor too. My interns will be like, do I have to see this one? I was like, yeah, you do.
You
Sorry,
have to
but
learn how to talk to them. Yeah.
you gotta learn. It's the tough one.
Yeah.
So just anyway, sorry, tiny pivot.
Well, no, it's true, but I have definitely had some of those too, where you know, and then depending on what their specialty is, like some of them are like, I don't know, I treat humans, but I don't know anything about animals, you know, and so like, and those people are you're always like, yes, you do. They're really very similar, but these are the differences, and then they're like, oh,
Yeah,
okay, I see. You know what I mean? And then we can have a nice conversation, and that's
exactly.
you know, and I'm always respectful because I mean, people are different, and also too,
Yeah.
you know, I don't think I know everything when it comes to my kids, and I go to the pediatrician, and I'm like, oh, okay, you're the expert, so I'm going to listen to you, and I'm going to have respect for that. And turns out I'm my pediatrician's veterinarian, so hopefully he feels the same way when he comes in.
That's a great relationship.
Yeah. For a little while, I was their dentist's veterinarian too, until I switched practices, and they were, you know, but that had
Gotcha.
nothing to do with that. She was like,
That's
"It's just
funny.
really far, or else I'd come see you." I'm like, "No, that's don't worry
It's
about it.
okay. It's fine.
It's all good. You're at a great place. I love the people you're with. I trust them. Have fun."
I like that. That's hilarious.
Yeah, but I think people just need to trust. And also you should have a veterinarian that will explain to you why
Yeah,
they want to recheck things,
yeah,
why you need to do that next step. You know, why was it important that we went from checking that blood work to a week later rechecking it? You know, there are things that change. If you think, oh, you know what, that's a little bit, you know, that white blood cell count's a little low. I have to make sure that it's not getting lower,
yeah,
and I'm going to know that in a week. So we need to recheck that. Well, there's a reason for it. You know what I mean? If anemia is getting worse, if you know what I mean, all these things, I think that serial blood work can often be good, and having a good baseline is really, really helpful.
yeah. Especially when something significant changes, their patch is not getting better. Like some of that stuff is really important. I couldn't stress that enough because sometimes I've been bitten in the ass because I've been like trying to save an owner money, being like, oh, we just did
Yes.
it. I was like, maybe we'll try
I
and do
really
X-rays
did.
first,
Yeah.
and then I always have to come back to it, and it's like I should have done this 3 hours earlier or a
Hmm.
whole day earlier, and my critic list is like, why didn't you do this early? I was like, I was trying to save the money. I was like, I'm sorry.
They're like, don't say that.
So I know they're like,
Now you cost
ultimately,
them more money. No, just kidding.
but I mean that's a really good
Sometimes.
point though. That's not like sometimes not doing that though ends up costing them more money in the process. That's a really good.
Because if you could have corrected it earlier.
Oh yeah, it would have been as bad, especially those diseases that do like Addison's. That disease, when they're really sick, can progress really fast.
Oh yeah.
Like those patients, it's an easy fix, but it's a horrible. Like an Addisonian crisis is horrible
Oh yeah.
if you're catching in the throes of it.
Hmm.
So it's
I think
yeah.
he was like teetering, like he was just like, and then if that if it had gone any lower, it would have been bad news.
Yeah, it can get really bad. So I think like that case in particular is a great example of why we repeat things.
Yeah. The other ones too are those ones that come to you. They're doing great, but got into an NSAID or a bunch of grapes or whatever it is. And so that night, you're not going to find the issue that night. But
Yes.
usually those people are supposed to come see me 3 days later
Yep.
or something like
Exactly.
that. And so listen to your emergency vet when they tell you, have this rechecked before it
Yeah.
becomes an acute kidney injury or fill in the
Honestly,
blank.
it happens all the time. There's like, yeah, no, we didn't. He didn't vomit the next day. I was like, did he eat? And they're like, well, he didn't eat as much. I'm like, go see your vet. That's the whole reason we talked about this.
Right.
So anyway,
But
it's
yeah, we all have the same goal. I think is really at the end of the day. Robert has the same goal as I have, and
yes,
when he's telling you we have to repeat something, there's a reason for it. When I'm telling you, I promise you there's a reason for it as well.
very very true. So it's funny.
But if you do have any questions, don't really think we can interpret your dog's blood work, but I'll remind you one more time, podcast at mybalto.com. But if you want to know why they would have recommended a certain test, or if you have questions about just any disease process in general or anything veterinary related, don't hesitate to reach out to us.
Yep. And if you really like our podcast, feel free to give it a 5-star review on whatever you listen it on
Yes,
because
because we're on all of them. So yes,
yeah,
5 stars, please.
yes, we appreciate we've had some really nice feedback from people and we're trying to grow our audience. So say hello and send us your emails.
Yeah. And thanks again for listening. This has been the Pause It podcast. We appreciate everybody tuning in. We've got some really good interviews and some fun stuff coming up. So make sure to keep listening.